I have to say, it is frightening to hear multiple leaders from the CDC saying, I can no longer work here essentially because I can't believe what's happening. I don't stand by that. And it's not good for the American people. You and I talk about, when we have our healthcare conversations, we talk a lot about the unintended consequences. What are they when it comes to this?
Well, I think obviously the major unintended consequence of casting down on vaccines, making it harder to get vaccines is the first is obvious. More people are going to get sick. Like, we're going to see more kids getting vaccine preventable diseases. We're going to see more sickness overall. We're going to see complications from these diseases. That's the most obvious and presumably unintended consequence, because I would like to think that there's not a desire to see kids get sick. Um, but I think more broadly, though, is America has been a leader in biotechnology and in the pharmaceutical industry for decades. But if our health policy is being dictated not by the best available science, but rather by, the particular ideology of whoever's in charge, we're going to see fewer drugs maybe get tested in the United States. We're going to see pharmaceutical companies shift to other markets, Europe and Asia and Africa, rather than the United States. We may see certain lines of research just get abandoned because perhaps there's a lot of drugs that it may not be worth putting the time and resources and money into developing if you can't sell them in the United States. So there may be treatments we never see. There may be treatments that Europeans get that we don't get. There are just going to be a lot of roads not taken in order to conform again to a non-scientific agenda.